Are you able to see Joyce?
Yes, ma'am.
Yeah. So the topic is, as I told you, the topic is sampling techniques in qualitative research, and we saw that how our goal and objectives are different in quantitative research, and therefore the sampling techniques are essentially different from quantitative research and qualitative research. So we surely have heard about convenience sampling. Now, this convenience sampling, as the name suggests, the prime importance here is the convenience of the investigator. So the sample which is there is easily accessible, available, and the participants are willing to be a part of the study. So logistically, it is very easy to collect data. And this approach reduces expenses, it saves on our time, it reduces any kind of inconvenience one would have while collecting the data. But however, whenever you use convenient sampling, remember that this is not probability sampling, and your statistical techniques do not carry any meaning when you use data collected through convenient sampling uh, to make any inferences in quantitative research, because this sample which is chosen using this technique has limited representativeness. That is, your sample does not represent the population of interest. There is selection bias. You cannot transfer your results to the population, and there is a question mark on the data credibility too. So overall, convenience sampling is a very weak sampling method because it does not have any underlying strategy or reason for choosing particular units in your sample. Now, this is an example. So, in all these slides, what I've done is on the left hand side, I'm telling you something about the technique, and on the right hand side, an example to understand what that sampling technique is like. So, in this example, supposing you want to study the barriers to ANC service utilization. So, instead of selecting many PHCs across a block or in a district, and including women with different ANC experiences with any predefined eligibility criteria, all you do is you say that I am going to select pregnant women on the day I am going to attend or I am going to visit that OPD in the PHC, and all the mothers who are going to be present there, all the pregnant women who are going to be present there, I am going to include them in the sample. Or I'm going to say that I'm going to interact with the ANMs who are posted in the nearest PHC to my institute, the PHC which is nearest to my institute, or the women who are residing closest to my institute. So I'm looking at the convenience which is a priority, and this is the greatest limitation of this kind of sampling. So whenever you do any study and you say that you are using convenience sampling, you have nothing to gain as far as research and the results of the study are concerned. This is something which we need to realize and give upon using this kind of sampling altogether. And then the next important thing to understand is that convenience sampling is not equal to purposive sampling. Purposive sampling is altogether a very different concept because you are selecting your sample with a purpose. So there is a underlying strategy based on which you are selecting units from the population into the sample. This is also known as purposeful sampling. Now, the goal here may not be representativeness as in a probability sample, but there will be some underlying reason why you are choosing some individuals or some units in your sample and not the others. And if you are able to articulate that reason properly in your methodology, that increases the reliability and trustworthiness of the findings in qualitative research. That on what basis, what is the rationale, and what is the reason that you have chosen some people or some units in your sample. Are you understanding the basic difference between convenience sampling and purposive sampling?
Yes, ma'am.
Yeah, thank
Yes.
you. So, what are the different types of purposive sampling? So, we have the extreme case sampling. Now, Extreme case sampling is where you deliberately select the positive extreme cases, that is, those who are unusually successful or who stand out on the positive side of the distribution. So when you use these kind of sampling techniques, your objective is essentially to identify the best practices or the facilitators and the enabling factors or some models of excellence which you want to report and identify the reasons why they have been able to gain the excellent stature. And this kind of sampling will be important when you are again having a goal of informing program strengthening or certain initiatives in the program which you want to strengthen, and you want to learn from the successful stories. So that will be known as extreme case sampling. Again, an example is supposing you want to find out what are the factors of achieving near universal institutional delivery coverage in a tribal areas. So again, instead of just selecting your PHCs or sub-centers randomly, you will not select any average PHC, but you will select the best performing PHCs in your block. Might be you will have a criteria that is in the past 2 years. Let me identify all the PHCs who have had, who are reporting 100% institution delivery in their catchment area, and then find out what are the factors which have led to that success. So this is an example of a purposive sampling. You are sampling with a purpose, and the purpose here is to select cases which are extremely successful or extreme positive cases. Just to the other extreme, we have what is known as a deviant sampling. So these are again extreme cases, but on the negative side. So the deviant case sampling means you want to target the least or the worst on the distribution. So these are negative outliers and they perform significantly below what is expected. Now here when you say that I am going to choose the deviant samples, that is the negative extremes, your objective here will be to understand what are the barriers, what are the systemic weaknesses, what are the failures, and what are the factors which are contributing to these failures. And such kind of sampling is important when you want to find out bottlenecks, barriers, and then suggest corrective action. So for example, you want to find out why some PHCs in a tribal area continue to report high rates of home deliveries, despite so many initiatives which are taken up by the government, or might be overall in the state, in rest of the district, the proportion of institution deliveries is improving, but there are a few hotspots where home deliveries continue. So here, instead of again choosing PHCs randomly or on an average performing PHCs, you will say that I am going to identify low performing PHCs and I am going to focus on these PHCs to identify what are the reasons that they are performing below par. So this is another example of purposive sampling. So what we have seen till now is that in qualitative research, we resort to non-probability sampling vis-a-vis quantitative research, where we have to use probability sampling. What we use in qualitative research is purposive sampling, which is not the same as convenience sampling. And then what we are looking at now are some examples of purposive sampling. One we saw was extreme case sampling, where we look at extreme positives, and then we have deviant case sampling, where we look at the extreme negatives. So naturally, when you say that I want to study the barriers and facilitators of XYZ, I will choose some extreme cases and some deviant cases to find out what are the facilitators in the former and the barriers in the latter. The third kind of sampling is known as the intensity rich sampling. These are the information rich cases. So here the idea is to understand the topic in your research question more clearly and meaningfully. You do not want to select the extreme outliers, but you want to identify individuals or units which manifest the phenomenon more intensely. It is not extremely. So if you know if you understand your research question properly, then you will have to identify who are the people who will be information rich as far as your topic is concerned. So if you choose the information rich cases with regards to your topic of interest, then you will be able to learn a great deal as regards your research question and answer it effectively. So you can go into great depth without focusing on the extreme cases, because one of the limitation of the extreme cases, deviant cases, is that they are usually very rare. And one of the advantages of intensity sampling is that you will usually get sufficient numbers when you want to conduct your study. So again, for example, if you want to find out what are the barriers to adherence to IFA supplementation under Anemia Mukt Bharat. So even if I am saying barriers here, understand that there is no point recruiting individuals who have severe anemia, who are at the extreme ends of the hemoglobin levels towards the negative side, but it would be more worthwhile to select pregnant women who have moderate anemia and who have been reported to have partial adherence for IFA tablets which have been dispensed to them. So these are not going to be very rare cases. You can easily access and enroll these cases, and they are in a better position to converse with you, to give you more time and comfortably respond to your questions. So though we are looking at barriers, we are not looking at any deviant cases here, but we are trying to reach out to information rich cases, because we want to find out what are the factors which act as barriers for IFA supplementation. So this is a little difficult to understand, vis-a-vis say the extreme or the deviant cases, but we want to get sufficient numbers and we want to identify people within the normal zone of say a normal distribution, but who are fulfilling the criteria and will be in a position to reflect, to think carefully, and to answer to your research questions. So the next type of purposive sampling is typical case sampling. Again, here um, the the way I would like to describe typical case sampling is, again, you want to choose a typical or a normal or a average unit instead of again going for any extreme or deviant case. So when you want to understand what is generally occurring, routinely occurring in a setting, so if you want to describe what is typically happening in a program, in an initiative, then you will also choose a typical case. So for example, if your research question is, how is routine ANC counseling delivered to pregnant women in a typical tribal district? So what you're looking at is routine counseling and in a typical PHC. So we do not want to focus on any atypical cases. No high performing, low performing PHCs with any kinds of resource constraint. So you would like to then, in this case, choose a typical PHC with an average service load, with routine resources which are typically present in a PHC, and you would enroll pregnant women who are attending the regular antenatal, who are seeking antenatal care on a regular basis and they do not have any complications. So you want to actually describe here the usual typical functioning and the way the counseling is delivered and sought and got by pregnant women. So you will try to therefore choose a normal, usual, typical PHC. This is a typical case sampling. Now, I am throwing many, names of sampling techniques. Now, is it important really to mug up all these names? See, it is not important for you to really keep remembering these names. What is important, especially when you are conducting a study, writing a methodology, is to write, to describe what was the criteria you chose for choosing your sample and what was the rationale for doing so, right? So if you are able to describe that clearly in clear terms, that is sufficient. But I'm just telling you a few tricks of describing your purposive sampling, and also the take home message that it is not sufficient in your qualitative research to say that I have or we have used purposive sampling, but go one step ahead and describe what was that purpose, and then describe it in any of the ways which we are learning today. Another technique in purposive sampling is maximum variation sampling. Now, here the participants will share a core characteristic which is relevant to your research question, but in addition to that characteristic, you are interested in a variation with regards to other characteristics or attributes. For example, supposing you want to explore women's experiences of accessing ANC services. So you want to see how do women experience and perceive these services in the tribal PHC area. So there will be one core characteristic. That will be a currently pregnant woman, a woman who has delivered in the past 6 months, but who has also been registered at a PHC, because we are interested in the experiences in PHC. Now, in addition to that, you will have maximum variation sampling, maximum variation with regards to what? Other characteristics. So I want to include women of different age groups, of different parity, different educational status, socioeconomic status, the distance of their residence from the PHC, and the timing of their registration. Now, this maximum variation sampling helps me capture diverse experiences, identify patterns across variation, see what are the contextual effects on the seeking antenatal care services, and therefore I am going to get an insight from multiple angles when I choose maximum variation sampling. So in maximum variation sampling, what do? You have one core inclusion criteria and you top it up with other attributes which will vary, so that you get a very holistic picture of understanding a particular phenomenon. Are you getting me till now?
Yes, ma'am. Yes, ma'am.
Yeah, thank you. The next one is homogeneous sampling. Now this is opposite. What is homogeneous sampling? You want to purposefully select individuals who share similar characteristics. So you want to reduce variation. This will simplify analysis, and especially when you want to do group interviews or you want to do a focus group discussion, you will go in for homogeneous sampling. So this reduces variation and it gives you a group which is similar with regards to important characteristics. This is important when your again goal is for in-depth understanding of a phenomenon which is a characteristic of that particular homogeneous group. So usually if there is, say, you are interested in a particular occupational group, that you will, in that case, you will resort to homogeneous sampling. So if you are interested, say, in the something which is pertaining to nurses or particular residents in a particular specialty, then you will resort to homogeneous sampling. So you are exploring experiences within a defined cadre or a defined risk group. In addition, uh, if you want to do subgroup analysis, you will also use homogeneous sampling. That is, within the subgroups, we'll have different strata, and each strata will be a homogeneous sample. An example here, again, this I will talk in greater detail, the subgroup analysis where it can be done in another kind of purposive sampling. But for homogeneous sampling, what is the example we have here? Supposing you want to find out what are the perception and experiences of primary gravida women regarding ANC registration in tribal PSCs. So now here you will not be able to include multigravida or women with previous history of cesarean sections or current high risk pregnancies or extremes of age group. So you will have to identify women whose experiences are similar to each other, and accordingly you have to specify your inclusion criteria to make all the units similar to each other and resort to what is known as homogeneous sampling. The next is this stratified purposeful sampling. Now here you divide the study population, like in your probability sampling into strata. So you have heterogeneous group, you make homogeneous subgroups. And then within that, you can use any of these purposive sampling to select your participants. Now this, if you want to compare subgroups, prior to your, sampling itself, that you want, one of the goals is to compare subgroups, then you will resort to a stratified purposeful sampling. Or you want to make the comparisons in terms of, say, identifying what are the differences between the two groups, what are the similarities, and also subgroup analysis helps you gain greater depth in your analysis. Now again, here the example is, how do perceptions and barriers differ among pregnant women based on timing of ANC registration? So when you are selecting pregnant women, you are going to select them as per the strata of the time of ANC registration. So you will select women who have registered early, late, or very late. And because the assumption is that there will be distinct behavioral patterns which you want to capture, and then in each of these stratum, you will use some purposive sampling to identify women for your in-depth interviews or for your focus group discussions, which can also be done because these are homogeneous samples within the strata. So this is stratified purposeful sampling. Then you have what is known as critical case sampling. Now here usually you will choose one case for your study because you believe that if it is true, whatever your findings you get for one case is likely to be true for all other similar cases. So this kind of thought, it permits logical generalization, and you just study one case and you can apply the findings to more such cases. So an example which is given is that instead of looking at all the patients who are admitted with COVID-19 and who survived on ventilator, you identify some critical cases and then you will be able to describe who were these cases who were able to survive. So you have to handpick the individuals in your sample in such a fashion that you have a gut feeling that if what I find for these few cases is going to hold true for all others who could be having a similar picture. So this is, I'll again give an example of critical case sampling. For example, you want to find out what are the systemic barriers in managing severe maternal anemia. Now here, you want to find out systemic factors which contribute to the delays in referral and management of life-threatening maternal anemia. Now, instead of selecting all women with anemia, I will look out for one case of a near miss. I'm sure all of you know what near miss is. Can anyone tell me what is near miss maternal event? Yes, yes, please.
Hello. Yes, ma'am. Hello, ma'am.
Yes, yes, please.
Yes, ma'am. So maternal nearness is of the pregnant females who were who got just escaped from the maternal death. Ma'am. They were at the verge of maternal death, but they got escaped, so that's why they will be classified in maternal nearness.
Yes. So they were on the verge of maternal mortality, but they survived, right? So there are many reasons why instead of just focusing on maternal mortality, we also are interested in these maternal near miss events. So if there is one such case and if that woman had severe anemia and she required emergency referral, but there were delays in referral, there were delays in blood transfusion, and however, she survived after intensive management. So this would be a critical case. So you would identify one such case, but you are not just going to look at that woman. You are going to interview her, her family members, all the healthcare professionals who are there in the care pathway, the blood bank officer, the ambulance driver, everyone, and you will build up a case study. And then whatever holds, you will say that okay, whatever holds true for this woman in this particular context, a similar thing can happen to any other woman, and therefore these are the reasons for the delays. these are the barriers, these are the bottlenecks, and therefore we give recommendations that these are the corrective actions which need to be taken, right? So this is identifying a critical case, and the best way to remember the critical case is when you feel that, okay, if I study this case, the findings are going to hold true. If this is true for this woman with severe anemia in this tribal district, then any other woman who has a similar picture will face similar hurdles, and therefore these are my recommendations. So this is an example of critical case sampling. The next one you all know is snowball, or also known as chain sampling. Here the researcher identifies one participant who meets your inclusion criteria, and the interview is taken. At the end of the interview, you ask the respondent, do you know someone else who has these criteria, who is like you? And that person, you go and interview that second person, and that person gives you or refers you to some more people like that, and you go on adding individuals to your sample. That is how you build up your sample size. That is known as snowball sampling. So again, when would you resort to snowball sampling? If it is hard to reach population, or they are socially sensitive issues, or you know that individuals you are going to recruit belong to informal or hidden networks. So in such cases, you will resort to this kind of sampling. So supposing you are interested in identifying the community level factors which lead to delayed ANC registration and to home deliveries in a tribal area. So the first step.
Sorry to interrupt, ma'am.
Yes, Shiva.
Ma'am, is this a type of purposeful sampling or is it third type, ma'am?
It is a purposive sampling. All what I'm
Okay,
telling
okay.
now are purposive sampling. Yes.
Yes, okay.
It means that when you are in your methodology, you can say that you have used purposive sampling in the form of snowball sampling, but you have to describe in detail how you're going to identify your first participant, what question you're going to ask that participant, and how you are then going to recruit the rest of the participants in your study. So in this example, which I am telling you all, that if you get the first person in your sample as a woman who was delivered at home and who had a delayed ANC registration, you interview her using your interview schedule. And at the end of the interview, you ask her, do you know any other woman in your village who has had similar experiences? And she may tell you the name of another woman who has delivered at home, or even a dai who has conducted the delivery. So you go and interview those women, and you then keep on getting more numbers in your sample as you identify more and more women who are directly or indirectly contributing to home deliveries in that particular village. That is snowball sampling. The next type of sampling is criterion sampling. Now here you have predefined inclusion exclusion criteria which are linked to your research question. So these are explicitly written down before you begin your study, and this is the best if you want to really enhance your internal validity and credibility in your qualitative research. So the question which we would think would be suitable for this kind of sampling is, what are the perceived barriers and facilitators to effective ANC counseling amongst high-risk pregnant women in a tribal area? So you will want residents in a notified tribal block. You would want women who are currently pregnant, who have attended at least one ANC, and then you will have a list of the criteria to say that they are high-risk pregnancy, and you would include those women in your sample. So if you have such a question where you know that you have to really clarify what that who all we will be eligible as far as that term is considered. For example, in this question, high risk pregnant women. So you will have to clarify in your inclusion criteria who all will be considered to be high risk. So that is criterion sampling, means you have explicit inclusion and exclusion criteria. Now this is another kind of sampling which is resorted to when you use grounded theory methodology. Now some of you all are interested in the grounded theory, and Grounded theory means what? That in qualitative research, you do not have any a priori theoretical framework for your study or any conceptual framework in your study, and your objective of your study is to start from ground zero and build up theory, build up a conceptual framework. Now when you have such a kind of a very ambitious goal, the kind of sampling you do is known as theory based or theoretical sampling. Now in this kind of sampling, it is essential that you do your data collection and your analysis simultaneously. And as you collect data and analyze data, categories and themes will emerge, which will help you to decide upon what will be your next sampling decision, whether you want to continue sampling and what kind of individuals you want to now include in your sample. Because your objective here is you have some categories and themes. As you start and begin with your study, somewhere along the way you get some themes and now you want to refine, test, elaborate on those themes, on those categories. To help you do that, you will require some kind of sampling units. So those decisions need to be taken in grounded theory methodology. Now later on, say halfway through your study or even later on in a grounded theory methodology study, you will seek cases which confirm or disconfirm to your theoretical construct. So you are coming up with some ideas. What you need to do is then challenge yourself and say, okay, let me search for cases which go against my theory, or let me see whether there are more cases which confirm to my ideas or to my theoretical construct. It is very important that you are actively searching for disconfirming cases, but you do not get any. It means that you are more confidence in your theory, in your themes, and in your categories. Are you getting me here? Some of you at least will be with me, I'm sure.
Yes, ma'am. Yes, ma'am.
Because this is a little bit difficult. But this kind of approach of theoretical sampling will give you more clarity. And when you say the word saturation in your sample size, it genuinely belongs, this theoretical saturation especially belongs to grounded theory methodology, because you are trying to refine, test, elaborate, build up on your theory, and a time comes when you feel that no matter whom I'm recruiting in my sample, nothing more is being added to the theory I'm generating. There are no new themes. There are no new relationships between the themes and the categories I see. It means that I have reached theoretical saturation, and this is a time to stop sampling or recruiting more people. So this kind of sampling, which is has a very solid theoretical foundation, is known as theory based or theoretical sampling. Read more about this. I'll give you an example. Might be this might help you to understand. So again here the context is that you want to explore socio-cultural and systemic determinants of delayed ANC registration. So in phase 1, you begin by interviewing pregnant women who have registered late. You also talk to ashas in the village and understand why are women in the village resorting to late registration. And after some interviews, there is one category which you are able to come up with, that there is influence of family authority, especially mothers-in-law, which lead to delays in decision making. So with a few more interviews, you are able to build a theoretical construct which you name as household power dynamics influencing timing of ANC registration. The next phase is you want to test and refine your theory, this theory of household power dynamics. So here now you will purposefully select mothers-in-law of pregnant women and husbands who are involved in decision making, and you will talk to them. And it may seem okay, whatever we are finding in phase 1 appears to be true because they are also on the same track. Then phase 3, now you want to confirm and identify disconfirming cases. So you will identify for confirming cases mothers-in-law who reveal that yes, believes there are reasons. You know that there are mothers-in-law now who have contributed directly, indirectly to delays in decision making, which led to delay or late registration. And you get to know that this happens because there is a belief that pregnancy should not be disclosed early, or there is preference for traditional home care. So this is confirming your theory, it's strengthening your theory. But you also at the same time want to identify disconfirming cases. So are there any women in this village who was residing in families which have a strong family hierarchy, who belong to conservative family structures, but yet who have registered early in their pregnancy? And when you interview the women, you understand that even in these contextual environments or in these circumstances, the active encouragement of ashas have overridden the household hierarchy. So you are able to refine your theory. So now you say, okay, household authority does influence ANC registration, but if there is proactive frontline engagement, means proactive support from frontline healthcare workers, that effect can be toned down. So this is what has happened. You began by interviewing pregnant women and ashas, but then you got to know, no, you have to interview other family members. And then within that scenario, you could identify people who will confirm or who will go against your theory, which will help you refine your theory of, as to why women register late, and are there mechanisms by which we can overcome these factors which affect delayed ANC registration. Are you able to get me here?
Yes, ma'am.
Yes, ma'am.
So you are not deciding about your sampling techniques beforehand. All you are saying is we are going to begin by interviewing pregnant women and some frontline workers, and then depending upon our analysis, the themes which we generate and our theoretical construct, we will identify more individuals who will help us confirm or disconfirm the theoretical constructs, so that we are able to refine and come up with our final conceptual framework. You can write this in your methodology. It means your sampling is going to be flexible, which is another characteristic feature of qualitative research. It will be iterative. That is, you will learn and you will build up upon your learnings, which is also another characteristic feature of qualitative research. I'm sure there are any first year PGs here, but please do go through the previous two lectures, because you will understand this lecture only if you understand what qualitative research is all about. The next type of sampling is opportunistic sampling. Now, what is this kind of sampling? You add new participants into your sample during your fieldwork because you get to know new things. There are emergent findings, there are new realities out there in the field, and you never thought that these individuals should have been included in your sample in the first place. It is only when you started collecting data and analyzing data, you thought that this cadre or this new entity needs to be included in your sample. So, for example, you are interviewing ASHAs, ANMs, medical officers regarding ANC counseling practices. And during the interviews, the ANMs report that traditional birth attendants, elderly women are important. It is no point just interviewing the healthcare workers. So this is opportunistic sampling, means in the field, you have realized that you need to include these people in your sample. So you are resorting to opportunistic sampling. So this is again a very, very flexible, iterative way of sampling. Then we have sampling politically important cases. I will not go into great details here, but you can, select one or very few politically sensitive or important cases when your objective is to draw attention and you want some action to be taken on the points which you are bringing out from your research. So if you say that these are the units which are in the limelight because they have been taken up in legislative debates, or they have been repeatedly mentioned or reported in the media or in the audit reports, or they are frequently being visited by political leadership, then you would take up those units, it could be districts, it could be blocks, villages, and you study those units in detail and report why that phenomenon is happening in that particular area. And that will invariably attract attention from the policymakers, from the bureaucracy, and it is very likely that there will be corrective actions which will be taken up. And hence, your objective here is to identify the politically visible entity and include it in your sample. So this will be done in very peculiar circumstances. And then of course, if your research objective is very broad and you have many secondary objectives which you want to fulfill, then you will use a mix of these purposive sampling techniques. So you could use typical case plus extreme and deviant cases. You may include some criterion also. And then you say that using all this, I'm going to build theory and therefore I'm also going to analyze it and resort to theoretical sampling. So if your scope of research is very broad and it's a very heterogeneous sample also which you need to recruit, then you may resort to a combination of purposive sampling techniques. That is also acceptable. So are you with me till here?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
So what I'm going to do now is actually show you some scenarios and I'm going to expect that you tell me what will be the appropriate sampling technique. So let's just see if we're able to do that. Remember that you may not remember the name of the sampling technique, but even if you are able to describe actually what you are going to do in your sampling technique, that's also fine. So the first question is factors contribute. You want to understand what are the factors which contribute to treatment interruption in the continuation phase of TB therapy. So can anyone tell me what kind of sampling you would use? Would you use a deviant sample or a extreme sample or a typical case, or have you already forgotten about the different types of? What I will do, I will stop the recording and then we will do this exercise.
Can you please show us the different